Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Any other thoughts?
Maybe about 60.
67.
Say 35.
And the answer is the first answer, 50%. I'm surprised that 50% of the people experience psychological or physical problems for at least 6 months. That's amazing. It's a devastating illness that has so many chronic ramifications that you wonder why people, if they know that, if they realize the dire consequences of COVID if you're not vaccinated, why they don't think about that and get vaccinated, because the long-term effect of COVID is difficult if you're not vaccinated. Then the incidence of death in those people who are not vaccinated is 20 times those of those who have been vaccinated. So I know I'm preaching to the choir, but anyway, just sharing information.
Yeah.
Any comments about that or thoughts about that?
Yeah, I heard that some of the people have similar effects like post-traumatic stress syndrome after COVID.
The same thing, yeah, right. That's the physical, the mental, the psychological impact of COVID, along with the physical effects. Yeah. Okay, John, I guess you can start this. And I hope everybody's already got their flu shot if they haven't. It's the time now to do it.
Yeah.
There's an interesting article on something that we've talked about, I guess, for a while now, in terms of the fat in the diet that is linked to stroke risk. And you see the meat there that animal fat is, of course, linked to a high risk of strokes, which, as contrasted with vegetable fats. And I guess there's been no end to the extent to which we've talked about the consequences of processed meat and the impact upon cardiovascular disease as well as cancer. And they talk a bit about what happens when you have a stroke. And there are two types of strokes. There's the hemorrhagic and the ischemic. When the ischemic occurs, that means you have no circulation. When a hemorrhage occurs, which is probably the least common but the most damaging, because if you have a stroke and you have ischemia, you have no supply. Often that can be restored, but when you have the hemorrhage, it causes problems that you may not be able to deal with. And so many people are therefore eliminating or minimizing the amount of red meats they eat and becoming vegetarians or vegans, as a matter of fact. And it's interesting the benefits that can have on your health. So those who haven't minimized their red meats may think about it, because it pays off important dividends. Yeah. Any other thoughts about it? We've talked about it ad nauseum, but anyway, any other comments or thoughts about it?
I heard McDonald's was coming out with a veggie burger.
Yeah, I've heard that. Yeah. Has it happened yet? I mean, I've heard all the talk about it.
I don't know.
And I wonder how many will eat it. after they make it.
I tried.
What did it taste like?
No, I would. I said,
Oh, you tried, yeah.
I would try it.
And of course, this is a good point to point out that not only is what you eat, but also the exercise and also keeping your weight down. Those two things have an additional benefit in elimination of cardiovascular diseases like heart attack and stroke. And
Yeah,
of
the
course,
The
kidney
problem
disease.
with getting plant-based food at a food joint is that it's going to have too much sodium.
And sodium is something that we don't handle very well,
Yeah.
otherwise known as salt. Yeah.
Mhm.
Okay, okay.
Okay, but we're preaching to the choir. Everybody knows all this already anyway. This is an interesting article because it talks about that because of the pandemic, people are missing some of the basic preventive measures, like missing the first dose of measles vaccine.
Mhm.
And it's large, as I said, 3 million more than 2019. It's the largest increase in children missing out on measles vaccine, of course. And measles was just about virtually gone at one point. And so they have great fear that measles, which is probably among the most contagious of all of the viruses, will come back. And that's why they're publicizing it, so that we'll be sure that all of the children, infants, will get their measles shots. And this is a global issue.
Are children here in the United States still required to get all the shots that they used to?
Before going to school,
Go
yeah.
to school. Okay.
Yeah.
I think due to the pandemic and the vaccine situation, it was a story on the news this week about some mothers are opting not to give vaccines to their children, these babies. And that could be detrimental too. I mean, for years and years, it was
Absolutely.
standard. Yeah. And now they're
Absolutely.
choosing not to.
Yeah, that's why I was asking. I was just wondering because
Yeah.
so much divisiveness about, the COVID vaccine. I wondered whether the parents, whether it was still really a requirement.
It's still required though. Yeah.
Okay.
And I talked with a young friend, I guess 35 years old or so. That's pretty young. About her 2 children, and the youngest is 5, has not had any vaccines, period.
Wow.
None.
None.
Wow.
But she was seriously thinking, and asked me my opinion. I laid it on her about the
That's insane.
about COVID at least, and
Well, not COVID among all of them. I mean,
All of them.
that's
Yes,
horrible.
that's scary. That is scary. Yeah.
That's awful. That mother's irresponsible because all those. It's not like COVID is just one of them.
right.
Yeah, about 5 vaccines they need. But anyway. Oh well, but your comment is well taken, that the downstream effect of all of this anti-vaccine is what we're talking about right now. And some people are not getting the standard vaccines, which is awful. Yeah, so it's interesting. We're in an era in which so many different things are happening. That, we haven't heard much talk about the Christians who were kidnapped in Haiti. You wonder what is going on and whether, because it's been now almost a month since they were kidnapped. I haven't heard a word. And it's kind of scary, even more scary than, as scary as in anything labeled smallpox is frightening, because we've just about eliminated smallpox off of the globe. And so you have something saying, oh, it's scary. And when they become missing, that becomes even scarier. And so, so it's a cause of concern, and not much we can do about it. It's an issue that is of global perspective, because smallpox virtually eliminated from the globe. When we were traveling, everybody had to get smallpox vaccination. And then it was done so extensively that smallpox was virtually eliminated. Now to hear that, and you know, when you talk about germ warfare, that's the kind of thing that they're referring to. Let's go to the next one. That's not good.
Dr. Callender, what were the extra vaccines that you had to get when you worked over in the islands?
Oh, smallpox was, well, and smallpox, and then you had to make sure you got the DPT, which was automatic, and but I think smallpox was the one that caused the most problem. The others weren't much. The DPT was not much, and all the others were updated. And then, of course, the other thing we had to do was take out malaria medicine. That was the other thing. So. This is an interesting development because there have been very few cures of HIV, and those that have been existed really have been from a bone marrow transplant or things of that nature. And so to have anyone who's actually cured from HIV and doesn't have to take the medications is unknown. And so bone marrow transplant so far has been the one exception to the rule. But so that this, to find one person who actually is cured from HIV is remarkable. The question, what you do now is you try to study that person and find out what about her makes her so special, and try to make that specialness applicable to everyone. But you can imagine, out of all the patients with HIV, and they're talking about millions, maybe billions, to have somebody who is free of HIV becomes a miracle study to try to find out what about makes that person so different. So it's going to be interesting to see how we do that. And this is a critical issue, scary, when you have US overdose deaths at 100,000 in 1 year. It just points out the epidemic of overdoses, and how perhaps COVID contributed to it. But it's just incredible how it continues to grow. Says now surpasses deaths for car crashes, guns, and even the flu, and close to diabetes. So it's and I think we think we're doing something about it, but obviously not doing enough. And then, of course, the fentanyl and addition to the drug has really made it worse. So, and there's so many addicts that of all ethnic groups, and it's frightening.
What is fentanyl?
Fentanyl is a drug
legally.
Well, it's not prescribed for anybody.
Oh, okay.
Because it's a drug that's used for anesthetics, put people to sleep. And so you really shouldn't be prescribed for anybody, although they have been doctors who prescribe, but as anesthesiologists are the one who have greatest access to it. But the drug dealers, they put fentanyl in it because it makes the high even higher. But the difference is you may not wake up from this high.
A big part of the problem with fentanyl now is that a lot of people are getting it online and it's coming in from China.
Yeah, well, it's lethal. And we're seeing the side effects. The other problem is that someone had mentioned last week that they had identified doctors as being a main source of it. And while they may be a source of it, they're one of the sources. I don't even think they're the main source, but anyway, that they had made a push, and they've made it very difficult for people who need pain medicine to get pain medicine because of the emphasis on the doctors. But they're often not the reason for the fentanyl. There are some exceptions to the rule, but I think this demonstrates that we've not come close to solving the problem of addiction, and I suspect the financial aspect of substance abuse is overwhelming. And as long as people can make millions and billions, it's going to take a lot to stop this epidemic that's killing our people, our young people.
Yeah, Dr. Callender, the dealers are lacing everything else now with fentanyl, like the K2, the artificial marijuana, crack, and powdered cocaine, because the fentanyl is highly addictive. So if you get it, you're gonna come back and get more. So that's what they want. They want repeat customers. So with that fentanyl is so powerful and highly addictive. Not only does it get you real high, but it's highly addictive to make you come back for more.
As if the cocaine is not already addictive enough, and the heroin. Yeah, so, but it makes a lot of money, so that's why it's been allowed to continue. Yeah.
Don't they have a drug now that can help people who have overdosed from a certain
Yes.
drug, like heroin?
Yes, it's available. Yes.
I heard it was available from a drugstore, over the counter. Is that true?
Yeah, they have done that. They've tried to make it easily available. Yeah. And they even give it out to people who they think are drug addicts, so they don't overdose. And the
But
police
doctor, I think also they were talking about with the fentanyl that Narcan is no longer becoming so effective.
Well, it's still effective. It may not be as effective, but it's still the only thing we have that
Correct.
reverses it. But you're right. Yeah.
There's synthetic fentanyl out on the street now also. That's even more dangerous than the real one. ONDCP has several articles out about it.
Yeah. Now, this is an interesting article about this woman who sued to get treated for her COVID with ivermectin, which is not a drug that is recommended for COVID. And the lawsuit was thrown out of court, and the lady died. It's interesting how drugs that aren't authorized for use are used anyway. And here she was suing the hospital so they could treat her with this medication. And of course, she says that the dose they were using was too low for her. And it's an interesting situation, because what they're suggesting is that the court should determine what dose the doctors should use and what drugs the doctors should use. And the courts felt that this was not their responsibility, and that they're not doctors and they can't identify what drugs should be used and not used. And they go by what the CDC and others groups decide is the best treatment, not extraordinary treatments which are not authorized. And that is what that lawsuit was all about. And I don't know if it'll be resolved, just like Trump was suggesting using the drug chloroxy. And most people want to use the drugs that are authorized rather than the drugs that are not authorized. And if you want to use an unauthorized drug, then you need not to go to the hospital because they don't give you the unauthorized drug. So that's what this case was all about. And it reached a lot of publicity because of the family wanting to insist that the doctor used the drug, whether they were familiar with it or not. And that's one of the problems. If you have somebody who uses the unauthorized drugs, then they may be using it in a different way, so with different dosages. So it becomes a tough cycle to deal with. Now, this is an article about flu, and it was predicted that this year's flu will be worse than last year's flu and the year before that. And here's an article at the University of Michigan that sudden almost epidemic of flu at the University of Michigan. Among those who contracted it, 70% didn't get the flu vaccine. It's now freedom to say no. So it's going to be interesting to see what happens in the coming months, because December, January, and February are the peak times for the flu. With the question, since many people are traveling for Thanksgiving, what is that going to do to COVID and to the flu? And since more than 40% of Americans may not get a flu shot this year, what does that mean? Does that mean the number of deaths is going to increase from flu? Prediction is that is going to be the case.
Dr. Callender, is there a time period after you get a flu shot when it becomes effective?
Yeah, it's about 2 to 3 weeks.
Okay. So it's a little late for a flu shot for Thanksgiving, though, right?
No, it's not late because most of the flu doesn't occur until December. So
I'm talking about for it to be effective by the family gathering time.
Oh, well, no, it's too late for that. But yeah, but the high season for flu is December, January, February. So you're right. But for Thanksgiving, how many of you are going to have a Thanksgiving dinner this year?
Oh, I will.
I will.
I will.
Any special precaution?
Yeah, just me and my wife. That's it.
Me and 20, 25 others.
No.
Any special precautions?
Well, everyone's vaccinated. We have room to spread out, and it's all immediate family.
How do you know they're all vaccinated?
And with that being said, normally it's a lot more. But since the pandemic, no. Have I received phone calls? Can I come? Yes. And I've said no.
How,
So
how do
it's,
you know they've had the vaccine?
how do I know they've been vaccinated?
Yes.
Because it's immediate family and I know they've been vaccinated. It's
Yeah.
not like I'm telling my sister and my sister's children, but then they have a friend. The friend I wouldn't know anything about. They're basically adults and maybe 4 or 5 under 10.
Yeah. My wife and I have had a discussion about that and the fact that the vulnerability of people coming who are not vaccinated, and she has the same feeling that you do, that it's family who are invited and they thought to be vaccinated.
Right. And it's all family, but you know, when the friends start calling, well, I'm a
Yeah.
friend of so-and-so's, you can't do that.
Well, actually, you know, the family spread of COVID is more impactful because of the similarity in DNA.
Mhm.
Yeah, it's that, as well as the fact that the interferon level is thought to be related. There's some families that don't have functional interferon because the substances or antibodies prevent the interferon from action. And so there's certain families that are more vulnerable to it. So. But if you've been vaccinated, that makes it less likely in the case. So the question, they talk about a twindemic, meaning flu and COVID. So let's see what happens. Let's hope that everybody gets vaccinated. But as we mentioned earlier, we're in an era of the right to do what I want to do when I want to do it. So now this is what we talked about last week also. The fact that Merck and Pfizer have a pill that reduces the deaths from coronavirus by almost 90%. Merck and Pfizer have requested authorization. It's not been approved yet, but we're hopeful that it will be, because this marks the way in which we will make the treatment of the coronavirus similar to the treatment of flu, because we have a vaccine for the flu, and we have a medication that is capable of treating the flu. And so now we will have medications that prevent the coronavirus and medications that prevent death from coronavirus, which will make it very similar to the flu. Except if you're not vaccinated for either. And then it makes it difficult, but.
Dr. Callender, are you aware of the mechanism of these pills? How do they work? What's the technology?
No, I'm not aware of it, and I don't think I will be aware of it until FDA has reviewed it and shares the information. It's very hopeful that this article is accurate, and by Christmas, 2 million children may be fully vaccinated. And of course, from the age of 5 and up, and of course now we have vaccines that are available for all. And this will make grandparents happy. I'm hopeful to have everybody in the family vaccinated. But it won't be a worry-free Thanksgiving. It might be a worry-free Christmas, but it won't be a worry-free Thanksgiving, because we still have many who are are not vaccinated. Are many of your children of your family and your friends getting vaccinated?
We have one set of grandchildren that live in Colombia. They're vaccinated, but I'm waiting for the Prince George's crew to get vaccinated. I was going to ask the question, does anybody know exactly how Prince George's is going about that vaccinations? Or
For children? For children?
Uh-huh.
I'm not sure if they've approved under 5. I believe
No,
they
this
have.
is from 5 to 11. Are they doing it in the schools or what are they doing? Because I just talked to my daughter and she was saying, trying to find out the channel, what are they doing in Prince George's of getting children from 5 to 11 vaccinated?
They did identify some schools, but offhand, I don't remember which ones. That is in PG County.
And I think at the Sports and Learning Center as well, they had something set up.
Oh, okay, good.
I don't know how frequently or what the schedule is, but the if you dial 311, there is a prompt for information on vaccines.
Okay. 311. Okay, thank you.
Well, that's interesting that still 60 million eligible adults and adolescents decline to get immunized.
Dr. Callender, there was a piece that I saw or heard, and I don't remember which now, but there's a physician that is offering treatments to counteract or to negate the vaccine for those people who were forced to take the vaccine because of their jobs. And now this physician is advertising this concoction that will reverse the vaccine.
Height of folly.
And it's I don't know what the name of it is, but it had stuff in it like baking powder, borax. Those are the two that I remember offhand. And
do they have studies that demonstrate that it reverses?
Oh, of course not.
Effective vaccine?
Of course not. But
It's
the minute I
amazing.
heard borax, I thought, oh my goodness,
Isn't that awful? That's sad.
Yeah, but it's and there are people who are buying into it and are actually subscribing to that nonsense.
That's amazing. Whatever you come up, no matter how ridiculous it is, people will go for it. Some percentage of people will go for it. What is that old saying? You can fool some of the people some of the time, and all of the people some of the time, but not all of the people all of the time. But no matter what you come up with, you find some people who will go for it, no matter how ridiculous it is.
It's to reduce the I know it was to reduce the radioactivity that's introduced to your body through the vaccine. That's what it is.
Oh my goodness. Yeah. Well, this is a frightening development that COVID cases are rising in Western Europe, and you wonder if this will affect other countries.
Now that they've opened our borders again, it's going to affect us.
That's right. Yeah. So, yeah. Well, this is particularly problematic for countries that are not vaccinated. It's bad enough for those that are, but those that aren't. This is bad news because, as you say, we travel now is once it's anywhere, it's going to be everywhere. So that's one of the hazards of our ability to travel now. Train, plane, whatever. You get it in one place, it travels to everywhere else. So So I guess we'll see. And actually 60% is not really a high vaccination rate. It's not high enough to help us think about herd immunity. So, oh boy, it's tough. Anyway, we're hoping that 21 will be the last year for COVID, but you never know. So, and the fact that the district has opened up things for unmasking and all that, it'll be interesting to see what Thanksgiving will bring. And there are already some studies that suggest that it may not pan out, but we'll just have to wait and see what are the impact of the Thanksgiving, because the travel is up about 80%. And so there will be many Thanksgiving families that are having Thanksgiving dinner with, and when you eat, masking is not anything that can be helpful. So.
Dr. Callender, there are some viruses that we have eradicated worldwide, like you mentioned smallpox. But do you think that COVID is going to be similar to the flu? We have not been able to eradicate the flu. That's why we have to take a flu shot every year. So do you think that COVID is going to fall in line like the flu shot, and we're going to have to take a shot?
I think so. I think so far, yeah, that's my guess so far. Yeah, we'll find out shortly, but that's my guess so far. And there's every reason to think that would be the case, because the flu that started in 1918, in many ways, is the forerunner of all the rest of the flus. And so this may be the same thing with COVID, but time will tell. We don't know for sure. So, and this is interesting in the New England states, where the Delta variant is mercilessly hitting the unvaccinated people. And it has been identified that the deaths in the unvaccinated are 20 times that in the vaccinated. So it makes sense to get vaccinated. We keep saying that, but people continue to insist upon their ability to say no. So Vermont, and other in the New England states, although they should have a higher vaccination rate than they do.
The rise in deaths in Vermont is interesting.
Yeah, it's troubling. And you'd think that would make more people want to be vaccinated, but our right to not be vaccinated remains. But it's interesting that the old people are not falling for that. But it's the younger people who are. And what has been most bothersome is to see all of the younger people who are dying as a consequence of COVID. Meaning people under 60 anyway. Yeah. Well, I think next week's results will be interesting to observe, to see what impact the Thanksgiving holiday will have on COVID and hospitalizations and deaths, which have bottomed out here in DC. And this then is an article that talks about having everybody vaccinated, which makes a lot of sense, since we are recognizing that after 6 months, the antibody titers are dropping. And so they're now suggesting boosters for not only the old and the immunosuppressed, but for everyone. But it's interesting because the number of people who are taking advantage of vaccine clinics is decreasing. And the fact that the boosters work demonstrates even further that getting vaccinated works, and getting boosted works as well. So it makes sense that all adults should get booster shots, which is what they're suggesting for all.
Dr. Callender, are the booster shots the same amount given as the original 2 doses, or the
No,
original
but
1 dose with Johnson
it-
& Johnson?
it depends. For Moderna, they give half the dose, but for everything else, it's the same dose.
Oh, okay.
But in Moderna, they give half the dose.
Dr. Callender, I heard that they're suggesting that the ones who got Johnson & Johnson should get the mRNA vaccine instead of actually getting another Johnson & Johnson.
Makes sense to me. If I had J&J, I would want to get either Moderna or Pfizer. It's amazing that we've had more than 750,000 deaths already from COVID. And still people are saying that they don't want to be vaccinated. Fewer than 1 in 3 seniors have received booster shots. That's shocking. It's interesting how we have used our right to not receive health treatments as a right to not take advantage of something that's going to save our lives. It's interesting. The mentality of that is interesting.
Dr. Callender, do we have a right to be put to death?
I don't know. Right to be put to death. I don't. What does that mean? You mean right to be killed?
No, I'm talking about Dr.
Assisted
Kevorkian.
suicide.
Yeah, Dr. Kevorkian's issue.
Well, and it depends on some states. That is allowed. Not very many. There's about 2 or 3 states where that's the case, but that's not generally the situation. And most of the doctors' Hippocrates oath is that you don't participate in that. That's not something that you're supposed to participate in as a physician.
As a physician, you're
Correct.
supposed to keep people alive.
That's correct. That's what I'm saying, right? And the oath that you take says that, right? It's interesting that they're trying to say that the CDC has not made it clear, which is correct. It hasn't made it clear that everybody needs to get a booster shot. And so that's what they're doing now. They say that everybody needs to get a booster shot. And previously it wasn't clear. Now it's clear.
Dr. Callender, do you think the booster shot is going to wear off after the 6 months?
We shall see. It's going to be interesting. I don't know the answer to that, but they'll do studies and find out. It'd be interesting because that will answer the question that somebody raised, and that is whether it's going to be coming back every year. Because if the titers decrease, then it will suggest that you probably need an annual booster. But we don't know the answer to that question. So it's still talking about if people refuse to take boosters, then we may still have the coronavirus with us in early 2022, as Fauci is suggesting. Interesting in many ways that we have the ability to control that in our hands. The question is, will we control it? I don't know. It's the way the mood is. I would think that we won't. But his last sentence is the right answer. It's a brand new virus we can't predict. We have to see what happens. One thing we know is that vaccination and boosters are good medicine. Not getting vaccinated and not getting booster shots is not recommended. This question was asked early on and it was answered many times, that it's very important for pregnant women to get vaccinated. And there was a lot of concern on part of some that the vaccination process would affect the mother and the child, but it is clear now that is not the truth.
Does a newborn from a mother who is vaccinated, does that newborn have the immunity? Do they have?
Yes, because they have placental. The newborn have the antibodies of the mother because they don't have any immune ability at all when they're born. So they have the immunity of the mother. So the placental antibodies protect them for the first 6 months or so. So this is a question you can easily answer anybody who has any concerns about the fact that they're pregnant and whether or not they need to take the shot or the booster. And the answer is yes to both.
Does the booster include the minors with the age range from 12 through 18? They should be getting a booster as well.
I think right now, I think everybody feels that all adults should. As the 12 to 18 has not been proven yet, but my recommendation is that everybody who has been vaccinated after 6 months should get a booster shot.
Okay.
I think it's after the 6 months because most of the kids are just getting their shots.
That's correct. And so you can't tell about the kids who are 5 through 12 because they're just getting the shots. And we don't know how they're going to act. So we would have to test them also and find out. We talked about the immunocompromised as well because that becomes even more important if they're pregnant. So because their child needs to have antibody titers so that they can fight off the virus as well. It's interesting, she say here, it says that 76% of Johnson recipients received a different vaccine for the booster. And I that's what I would recommend as well. It's interesting how the side effects of the vaccine was so different from person to person, even though they weren't very severe for most, but they varied very, very much from one person to another. Some people are having no effects and some people have great effects. Any other questions about that? Now, this is a question that many had. Could you get your vaccines on the same day? And because there were no studies on it, some people did and some didn't because they didn't have a lot of information on it. And the initial advice was to spread them apart, but that was because nobody knew the answer. So now we get.
When I went to get my booster shot, I asked if I could just go ahead and get my flu shot. And the person who administered the shot said, why don't you wait a day or two just in case you have a little soreness from the booster. So that's what I did. I waited a few days. I went back about 3 days later and got my flu shot.
Yeah, it makes sense. Yeah. Yeah. Very few side effects from the flu shot, though. Anybody have side effects from the flu shot?
People claim that they have flu-like symptoms after they get their flu shot, but I don't believe it.
Yeah, well, yeah. Yeah, some people do claim that, yeah. think it's clear now that since we are approaching the flu season, and if you had not received a flu shot or a COVID shot, it would make sense if you wanted to get it both at the same time, or as you mentioned, wait a day or two apart. The reason why the proximity is because the flu season is right upon us. December is flu season, so they're getting close. So the sooner you get it, the better in terms of the flu shot. Without question, there's no question about the COVID shot.
Dr. Callender, is there any age restriction for the flu shot for kids? Or
No.
recommendation?
No. And it's clear that those who get the flu vaccine do better than those who don't. Most of the people who die from the flu have not gotten the vaccine. We don't talk much about hepatitis A. That's a vaccine that that's hepatitis A. Is we don't talk much about it. We talk more about B and C because those are the counters. People who have sex, men who have sex with men, as well as people who are homeless and illicit drug use, increased incidence of hepatitis A. But, they talk about the pneumonia vaccine, which sooner you get the better. Then we've talked many times about the shingles vaccine. Once you've got the shingles, you never forget it. And you don't want to get shingles. So. And there's a time between the doses of the pneumonia vaccine. So you get the first shot when you can, so that you wait to get the second one. This is a good article putting into perspective the need for all the different vaccinations. You can see
Dr.
that get them all at the same time.
Dr. Callender, I had the series of the hepatitis vaccine. I don't know what it covers, A, B, C, but I had I think it's 3-month series. And then they test you, and then I didn't have any antibodies, so I have to go through it again.
Right. Yeah, that's the thing with hepatitis B, that if you don't develop the antibodies, then you have to keep getting injections until you do. Because you're not protected unless you have antibody titers. And if you're a transplant patient who's received all those immunocompromising medications, then that may well be the case. Now, what is true, in spite of the DC lifting up the requirement for masks in general, they also have required that certain public places like basketball games and other things like that still require masks indoor. Now, the question is, are people going to follow it? Are they going to think that because they said you don't need to wear a mask, that applies to all events? It does not. And so you have to read the requirements, and there are public places where indoor events where masks are still required.
It's still required on public transportation as well.
Yes, that's right. That's right.
And libraries and public schools.
And at the hockey and basketball games, which are indoors.
And at my house.
Now, this is an interesting article. Combating coronavirus should not be politicized. He's right, it should not be, but it is. Yeah, it's interesting that we've chosen to politicize it. And I think the intent was to get those people who are not vaccinated, to encourage them to be vaccinated. And the fact that many of the Republicans who are not vaccinated, and many of the Democrats are, it is easy for it to become politicized. And the issue with the police officers, the frontline workers being mandated to take it has been an interesting situation. Because frontline workers are likely to encounter people who are unmasked and unvaccinated. So,
What about the situation at the Capitol on January the 6th? Was it a situation where the police were wearing masks, but the protesters didn't care about a mask because Trump told them that they don't have to worry about nothing?
I don't know what was said. So there's a lot of stories, and I don't know what really happened. I guess we will eventually find out, but I'm not sure. So many rumors and so many stories. It's tough to say what is the real truth. It's funny that they would protest against the virus, and those are the people who need it the most. But they walked off the job, and of course we know one of the police officers who refused to be vaccinated died of COVID.
You know, it's like I've been saying, maybe if they said it didn't have to be mandated, that they would get it. You know, especially, you know, there's a group of people, especially addicts, who if you're told to do something, then you won't do it. You know, it's a rebellious kind of attitude. But
Yeah.
you make it totally voluntary. I wonder if there's any studies on that. Just make
Well,
it
I'm sure, but that's not good public health. And there may you don't need to have studies to indicate that if you don't take the vaccine, that you're likely to die. So if something's going to kill you, then it's important that you know that you need to take the vaccine. So as the doctor's saying, it's a public health issue. So public health is that you want to prevent what you can rather than treat something. And so an ounce of prevention is worth a pound of cure. And that's the policy that is eminent everywhere. And so to not tell that truth is so the mandate is because you want to protect the majority of people from getting the disease. And so it's good public health to do so.
Everything I've read said that the mandates are very effective.
Yeah, that's right.
You know, when the vaccine first came out, it was not a mandate, it was voluntary. And it was only because people weren't doing it that they started mandating.
No, it was because people are dying.
Yeah, dying and
They're dying. That's why they did it. People are dying.
yeah.
And the
Not only because
employment mandates are most effective because given a choice between keeping your job and getting the vaccine, they get the vaccine.
that's tragic, isn't it? Yeah, that's tragic. That would be the reason you get the vaccine. But that was the case for many people. Remember, we looked at the numbers of people who actually left their jobs because they didn't want to get vaccinated, and it was in the vicinity of what, 1 to 5%. so that 95 to 95% of the people did just what Darryl said. They kept their jobs. Yeah, we know that Trump did that, and it was a great noble deed. And they always wondered what happened after that. And I guess this article's trying to tell us about it. I thought it was I thought it was wonderful. I thought Trump was courageous and wonderful in doing that. This article is suggesting that there was many a slip between the cup and the lip, which is not unusual.
A slip between the cup and the lip.
Yeah, many a slip between the cup and the lip. Yeah, that's right. Old time saying. Yeah. It's interesting how wow. It's interesting when you look into the details about what you plan to do, what you try to do, and what is actually done. How the difference between the two is interesting. Because the bottom line is that little of that money actually was actually used to help us. Although what it did purchase, though, is the vaccine for everyone, and so everyone in the United States got the vaccine for free. So that was a great accomplishment.
And this is the last article.
I thought this was hilarious that that they would cancel a fundraiser because of his own feeling about transgender stuff. And that's interesting. Cutting off your nose to spite your face. Interesting. Because this Dave Chappelle is an alumnus of
Duke Ellington.
Duke Ellington, right? And he's made many gifts to Duke Ellington, and now they protest because he has his own feeling about it. Sometimes I wonder about some of these protests and the reasons for the protests, because to me it makes no sense. But of course, because somebody has unique, special, personal feelings about a subject that don't agree with yours, is that a reason to not accept the money? Well, for them it was, but makes you wonder.
Are they still naming the place after him?
It's already named after him.
Oh, okay.
It's already named after him.
Oh.
So this was to announce it and also to raise even more funds as a consequence for the school, which they could use the funds.
Mhm.
And they have so many gifted people at Duke Ellington. But anyway, it's interesting, and unless you're a transgender, I guess you might not understand why they had that protest.
I was over at Ellington in 19, and the school, the rebuild. I mean, it is awesome. It is beautiful inside. It's state of the art. They have computers in the classrooms. They have all of the orchestral instruments and band instruments you could ever imagine. I mean, it's an amazing place. It really is.
Now, why couldn't they have had all that when I worked there?
Sorry. You liked him being transgender to wearing blackface. I don't understand that either at all, but I don't know what. Very few of you in this call know what blackface is about. I'm sure the older people like me know, but I didn't have any bad feeling about blackface. Al Jolson and those people, white people, wore blackface, and I don't know what he meant by that. You have to explain to me what he meant by, because transgender is very different from wearing blackface. But anyway, I like to hear his side of the story before I would refuse to accept the money that he's giving to help the place grow and develop. But it would take a transgender and somebody who is more understanding about what's the negative blackface commentary.
Okie dokie.
Any thoughts about blackface or transgender?
I'm like you,
Hello.
when I saw blackface as, you know, Al Jolson and all of that, it was just art.